What are ICD-10 codes? ICD, short for International Statistical Classification of Diseases and Related Health Problems, is a medical classification system list which contains codes for diseases, signs and symptoms, abnormal findings, complaints, social circumstances, and external causes of injury or diseases. By cataloging and standardizing these factors, ICD-10 hopes to build a foundation for the identification of health trends and statistics globally, and the international standard for reporting diseases and health conditions. Uses of ICD include monitoring of the incidence and prevalence of diseases, observing reimbursements and resource allocation trends, and keeping track of safety and quality guidelines. They also include the counting of deaths as well as diseases, injuries, symptoms, reasons for encounter, factors that influence health status, and external causes of disease. ICD was initially developed in the 18th century and later delegated for periodic revisions to the World Health Organization, WHO, by the United Nations in 1948. In 1979, the ninth revision of ICD, ICD-9-CM, became the required standard for billing and clinical purposes by the most U.S. payers, such as the Centers for Medicare and Medicaid Services, CMS. In an effort to address limitations of the ninth revision and thus improve the clinical accuracy, the United States Department of Health and Human Services mandated that all entities covered by the Health Insurance Portability and Accountability Act, HIPAA, use ICD-10 for electronic healthcare transactions starting from October 1, 2015. As of 2015, there are 141,747 ICD-10 codes. ICD-10 codes are characterized and categorized into diagnosis codes, ICD-10-CM, and procedure codes, ICD-10-PCS. ICD-10-CM diagnosis codes are 3 to 7 characters long and contain a letter as the first character, number as the second character, and either letter or number for characters 3 through 7. ICD-10-PCS procedural codes are always 7 characters long, and all characters can be alpha or numeric. Letters in the ICD-10 PCS codes range from A to H, J to N, and P to Z. The granularity of ICD-10-CM and ICD-10-PCS is vastly improved over ICD-9-CM and enables greater specificity in identifying health conditions. It also provides better data for measuring and tracking healthcare utilization and the quality of patient care. ICD-10 includes laterality, severity, and complexity of disease conditions, which enables precise identification and tracking of specific conditions. Injuries, poisonings, and external causes are much more detailed in ICD-10-CM than previous revisions, including the severity of injuries and how and where injuries happened. Extensions are also used to provide additional information for many injury codes. Post-operative codes are expanded and now distinguish between intraoperative and post-procedural complications. In addition, there are new concepts that did not exist in previous revisions, such as underdosing, blood type, the Glasgow Coma Scale, and alcohol level. ICD code lists are managed by the ICD-10 Coordination and Maintenance Committee, which is comprised of representatives from the Centers of Medicare and Medicaid Services and the Centers for Disease Control and Prevention's National Health Center for Statistics. The committee is responsible for approving coding changes, developing errata, addenda, and other modifications. Requests for coding changes are submitted to the committee for discussion at bi-yearly coordination and maintenance meetings.